Good morning, Dr. Reddy. Thanks for taking out time for the Business Standard Show.
Good morning.
And
Happy to be here.
so, my first question to you would be that was it the right time to declare the end of the pandemic, or is it too late or too early? What is your opinion?
Well, I think it could have been done a little earlier, but I believe, given the fact that in some parts of the world, still there were a very large number of cases, and including a fairly high number of daily deaths, and the fact that in China, after the sudden opening up, there were reported large number of cases, and there were predictions through incorrect models, as it appears, of anticipated high number of deaths in China. I think the World Health Organization decided to be a little more cautious and wait for time and study the trends. And I think while it might have been slightly delayed, it has come, I think, to a right conclusion that the pandemic must be declared not as having ended, but having ceased to be a global public health emergency.
Right. And what kind of investments you think need to continue for COVID-19 in India as well as globally?
Well, as I said, we need to build a very strong health system, strengthen urban and rural primary health care, then also ensure that you build up an adequate health workforce in numbers, skills, and distribution. Now, if you do not have enough primary healthcare workers, frontline health workers, if you do not have enough lab technicians for doing the lab tests, if you do not have enough critical care personnel for administering critical care in whichever setting, whether it's a district hospital or a medical college hospital, then we are going to be caught short-handed. And remember, not only we have shortages of health workers, there are also human beings who are likely to get infected. Some of them will die. Some of them will become ill and incapable of performing their duties. And even if they're young, the moment they're infected and diagnosed to be infected, they're asked to isolate themselves. So either because of illness or because of exhaustion, they're unlikely to be always available in full numbers. So you need to have what I call a slack capacity, an expansile capacity, which can call upon those additional reserves, whether it's nurses or doctors or frontline health workers. So a strong health workforce and primary healthcare systems are absolutely important, along with emergency transport systems. And of course, now telehealth and telemedicine have been built, and digital health has been deployed fairly well after the initial stages of the pandemic. All of those resources, we need to continue to develop and invest in them as we move along.
We use vaccines for other infectious diseases as an annual dosage for children. Is it about time that we think of having an annual vaccination program for COVID-19 for adults?
Well, right now the evidence is not very convincing, or we need more evidence for that. Firstly, children themselves are not at very high risk. The people at high risk are people who are elderly, whose immunity has weak, and even if vaccinated, it might wane very fast, faster than of younger individuals. People who are immunocompromised, immunodeficient, or on chemotherapy, they're at much greater risk. People who have severe comorbidities are likely to be affected also much more. And therefore, these are the people who ought to be really protected. And in them, again, while it is advisable that we boost their immunity by giving them boosters, whether it should be annual or not needs to be seen. The rest of the population at the moment does not appear to be in need of a booster dose. Secondly, we must also be a little cautious about excessive use of booster doses, because if these are repeatedly challenging the body's immune system, to react to that particular antigen, then it's always fighting the same battle. It is, firstly, there is something called T cell exhaustion. The T cells, which are very important components of the immune system, may get exhausted by fighting these battles repeatedly. And the body's immune system may not have the capacity to react to a new variant because they're still identifying the vaccine-related antigen as the only enemy. If a new variant comes in, then it may not be able to react to that. Or against other microbes as well. If you're already exhausted, most of your resources are exhausted in fighting the antigen that is being provided by the vaccine, your body may not have the capacity. So you have to do that risk-benefit analysis and say, okay, which is the group that is most likely at high risk and who is likely to get high benefit, and which are the other groups where the benefits are low and the potential risk of excessive booster doses may be high. So I think we have to be judicious in our choice of whether we are advocating boosters, when and to whom.
So, what are the key lessons that we've learned in the last 3 years, you would say, as a public health expert?
There have been very many. I mean, if you want to start even with the idea of preventing the pandemic in terms of preventing a spillover, we know that if we are really talking about natural origins of this particular pandemic, like many other zoonotic infections and outbreaks that have happened over the last 60 years, we must actually protect and preserve our ecological barriers so that the virus does not spill over very easily from wildlife to veterinary populations and then spread through the human habitat. So that ecological sanctity is something that we must continue to maintain or even build upon, including biodiversity. And if we flout that, then we are likely to leave ourselves exposed to many more future pandemics purely because of zoonotic transmission. Secondly, we also must recognize that whenever there is an outbreak, we need very early detection. We need very strong early alerts coming in, both from the region where the outbreak is happening and then subsequent transmission to not only the World Health Organization, but all across the world to all other countries, so that people can start taking preventive measures and also keep a watch on whether there is transmission from one country to another country. So I believe strong surveillance systems are needed and very clear methods of ensuring accurate and data collection and speedy transfer of that data. The alerts and the data must cross international borders before viruses and variants do. That is the one fundamental lesson. Then, of course, we must also keep our health systems very much ready in reserve to meet such an emergency. Unless we have an efficient and equitable and empathetic health system functioning predictably in the steady state, even without an emergency, you cannot build a strong, swift, and sustained surge response needed to meet that emergency.
Thank you so much, sir.
If you like this video, share it and subscribe to Business Standard. For more news, views and insights, log on to www.business-standard.com. Do also follow us on YouTube, Twitter, Facebook, Instagram, Telegram and LinkedIn.